healthcare is on the ballot for 2026 because there is no more frontal attack that's coming from Washington on California than on healthcare. When we lose that much money, and it's overall $1 trillion cut to Medicaid, the ACA, wait a month and you will find if any of you have, if any of you are the 24 million Americans who have Affordable Care Act coverage, insurance coverage, wait till you see what your premiums will be if Republicans don't work with Democrats to protect the subsidies that were provided. It will be unaffordable for most middle class. This is for middle class families, not for poor folks, middle class families. Healthcare is on the ballot. I intend to be California's healthcare governor because I understand the risk of not addressing healthcare. You know what happens if you've ever been uninsured. You know what happens if your child is ill, hurting. You wait to see if you can get them cured with what you can do. If they keep getting worse, you wait, and you wait until there's no waiting because that's your child. Then you take them to the hospital, but you can't pay the bill. So what happens? The hospital has to swallow the cost. Taxpayers end up having to cover it. Or you and me, as holders of health insurance coverage, pay because our premiums go up to cover the cost because the hospital has to get payment from somewhere. Either that or the hospital closes down. And so we're not going backwards. How do I get the money? I've already spoken to most of the healthcare sector, hospitals, doctors, community centers, nursing homes. Everyone's going to have to tighten their belt a bit, but there is money. We spend more money in this country, in this state, than any other place in the world when it comes to healthcare. There is what I call a lot of friction in the system. People who don't add healthcare value, medical value to that dollar. And I think we can get rid of some of the friction. All the administrators, all the middlemen who take money out of the system before you get your health care. And what I would say is that we have to make sure that we're protecting the healthcare workers because there could be such burnout that we can least afford to lose the people who are actually doing the care right now. And so we can figure this out. We have no choice but to figure it out because if we don't, it's going to cost us more in the long run when people walk in to get their health care, not through the primary care physician's office, but through the door of the emergency room.